We are pleased to welcome Al Campanella, who is Executive Vice President of Strategic Business Growth at Virtua. Strategic Business Growth, what does that mean?
Well, Steve, I have an exciting job. I get to help create new programs at Virtua, sometimes working internally and other times working with partners in the community.
Now, we've been down to Virtua to do some fascinating shoots around a whole range of subjects, and one of them we've learned a lot about and we want to talk about here is telehealth. What is it and where are we going, Al?
Well, telehealth is an exciting new technology. It's another venue, really, where healthcare can be delivered. So we see telehealth, or I should say, really audio-visual technology in our daily life, Facebook, Skype. So it's really, that technology is really now being introduced into the mainstream of healthcare.
Let's play it out a little bit. For instance, we've had different physicians on who've talked about it, but from a strategic, business growth perspective, give us a for instance out at your shop where telehealth will play out. In what instance? Where does it work?
So we have several instances at Virtua. One right now, for example, is with new moms. When they go home from the hospital with their newborn, sometimes they have problems with nursing their child. So we have lactation consultants who they can access over telehealth. So they're in the comfort of their home, they have a newborn, they may have other children with them, and we provide that counseling service over an audiovisual type of technology.
So hold on, Al, the mom's there. She reaches out. Is she able to see the consultant on the other end?
Absolutely.
And this consultant, I'm sorry for interrupting, the consultant can see her?
Absolutely. And they can talk and they can, work through their consultation.
So first of all, it takes some of the transportation issues out of it, if I'm not mistaken.
It's very convenient. It will save time. It will save perhaps a downstream problem that could be occurring. A second great example is in our nursing homes. We have specialists who, again, use telehealth technology to consult with patients who are in the nursing home, and in many cases having them avoid what would be an emergency room visit because of an issue that's cropped up while they're in the nursing home or skilled nursing facility.
And Teledoc, what is Teledoc?
So Teledoc is a national service.
Is that a company?
It's a company, and Virtua is partnered with them. So there's a handful of our physicians who are part of the Teledoc pool of physicians that serve in various states, including New Jersey. So that's one aspect of our program. It's an on-demand program, meaning once you register and need a service, physician service, you can request it online, and usually within 15 minutes or so, you have access to a doctor. Now, that's different from a scheduled telehealth visit. So we also have a platform that we control directly. I mentioned the consultation, the lactation example, the nursing home example. We also have follow-up visits for urgent care. So let's say you go to one of our 8 urgent care centers and you have a laceration, and a day or so later, the physician will say, you can use telehealth technology. I can then look at the laceration to make sure it's healing properly.
Hold on now. Well, I want to be clear on this. It's important we can break this down. So you may not have to go back to the facility. You may if the doctor, he or she believes it's right, but the doctor can see the laceration. And then what? Play this out.
So the doctor, let's say it's 1 or 2 days later, can see the laceration and see that an infection is not occurring, can see that it looks like it's healing properly. Another example might be a severe bug bite. I had one myself, where I had a bug bite on my arm. It was this, rather large bug bite. And then 2 days later, the doctor could look at the bug bite and see that it was decreasing in size and was healing correctly.
Now, press it a little bit further. You're going through this telehealth situation. There's communication visually, audio as well. The physician or a clinical professional sees something that he or she says, wait a minute, hold on. I don't like this, or I want to know more.
So a physician's always using his or her professional judgment in any situation. So if they determine that you need to be physically seen in a primary care office or a doctor's office, an urgent care setting, or even the emergency department, they will say to you, this telehealth encounter, it can only go so far. You need to see a physician in an actual physical setting.
So the New Jersey State Legislature has literally hundreds, if not thousands, of bills moving through it or not, stuck. But there is, in fact, legislation dealing with telehealth. What is that legislation now, and why does it matter?
So there's a bill going through the legislative process right now, and it's really to help give New Jersey a comprehensive telehealth set of regulations. And what are regulations? Regulations are there really to safeguard the public. So the bill is really looking at, first of all, when is telehealth appropriate? And typically that decision is left really to the physician, and I think that's going to proceed as we determine. The second is really around payment for telehealth services.
You mean the amount? Hold on. The government would establish an amount for telehealth?
Well, the government would help determine if insurance carriers should be providing reimbursement payment for telehealth services like they do for many other face-to-face type encounters. So today, presently, there are very few instances where there is insurance payment for telehealth services. This law, if it proceeds, will allow, hopefully, parity for services that are delivered via telehealth. So it's ultimately about not discriminating really against physicians. They're still providing their professional judgment. They still have the normal overhead costs of malpractice and running their office. This is another tool. It's part of their time, and it does deserve to be reimbursed.
As we finish up here, telehealth is going to be a part of our life and may, in fact, be even bigger part of our life.
Telehealth is already part of the healthcare ecosystem. It's very popular on the West Coast. The VA has used it for years, as has the military. It's now coming to the East Coast as a more commonplace venue of care.
Al Campanella, thank you so much from Virtua. We appreciate it. Well said. Thank you, buddy.
Thank you. Thanks, Steve.